Delirium, a confused state of mind. So what is delirium exactly? Delirium can be defined as a complex neuropsychiatric disorder marked by an alteration in the level of consciousness, attentional dysfunction, disturbances in other cognitive domains including memory, orientation, and language, and associated changes in non-cognitive domains of motor behavior, perception, sleep-wake cycle, and thought process. However, most people just sum it up as a state of massive mental confusion. Delirium can range in severity from mild to severe. It can be considered acute, meaning the symptoms only last a few hours or days, or it can be persistent, meaning that the symptoms can last weeks or months. Delirium can occur in any age group. However, it is most often seen in the elderly population. It occurs between 1 to 2% in the general population, 14% in individuals over 85 years old, and 83% in individuals towards the end of life. Factors such as staying in a hospital or hospital-like setting and undergoing operations can increase these percentages. There are several causes of delirium. These include the occurrence of a fever, having a disease and/or infection, poor nutrition, having a head injury, having a stroke, stress, intoxication of certain substances, which is commonly seen with prescription medication, or substance withdrawal, with alcohol withdrawal being the most common. There are several symptoms that occur when suffering from delirium. These include disturbances in awareness, such as reduced adjustment to the current environmental situation, disturbances in attention, such as a reduced ability to direct, focus, sustain, or shift attention when needed. Symptoms also include changes in cognitive ability, including memory loss, learning ability, confusion of current time or location, alteration of language, and perceptual distortions, such as hallucinations, illusions, or misinterpretations. Delirium also causes disturbances in the sleep-wake cycle. A patient may sleep throughout the day and stay awake all night. Delirium patients can also have problems with their emotional state and rapidly and unpredictably shift from one emotion to the other, such as being really anxious, then shift into being really angry. There are several treatment options that can be used to treat delirium. Psychiatric management is normally the first step. Psychiatrists gather background information to decide best treatment routes for patients. This includes identifying underlying cause or causes of delirium in patients, providing safe environments for patients, and providing psychiatric management before and after treatments, such as keeping the patient and family aware with what is going on. Environmental and supportive interventions are typically the first line of treatment. Environmental interventions include changing the patient's surroundings, which can reduce the several factors that can cause delirium or make it worse. This can be done by familiarization, such as photographs of family or favorite items, orientation, such as placing the clocks and calendars in the room, and organization, such as regulating light between daytime and nighttime. Supportive interventions provide emotional and cognitive support to the patient. These include things such as reorientation of cognitive thinking, like asking the patient their name and where they are, and reassuring the patient of their worries, such as letting the patient know that these symptoms are only temporary. Somatic intervention includes the use of medication to help reduce or eliminate symptoms of delirium. Medications such as antipsychotics, benzodiazepines, and cholinergics can be used. Antipsychotics are normally the medication of choice. Delirium has been studied for multiple years and has provided great results and findings that can be used in the practices of modern medicine to help prevent and treat the delirium cases that are diagnosed on a daily basis. The continuation of these studies of this disorder will hopefully eventually eliminate the existence of delirium in future generations. Thank you so much for watching my presentation and learning about delirium.